children 5 and older. Tonight, we're speaking with the chair of infection control at Huntington Hospital for Northwell Health about what he says if you're considering the booster for your children.
This is an updated version covering the newer variants that are circulating in the United States, specifically the BA4 and the BA5 variant.
Dr. Adrian Popp says the epidemic has changed, but still recommends getting your child vaccinated. For starters, he says the good news is COVID is not as deadly as it used to be, likely because of vaccinations and those who built up immunity after being infected.
But the bad news is this BA4 and BA5 are a lot more transmissible. In other words, it's so much easier to transmit nowadays, these sort of variants.
And even though since the pandemic started, children only make up 19% of those infected, and Dr. Popp says,
the reality is, yes, kids have milder diseases than adults.
He also still strongly recommends getting them vaccinated, mainly because children, as he puts it, are the engine of transmission of all types of illnesses.
COVID being one of them. They go around, they go to school, they mix with other kids, and they come home. And at home, we have also older people, our parents, our grandparents, who may not be in the greatest shape.
And even though with both variants being more easily transmitted, Popp says it's understandable that many of us are simply over the pandemic.
Everybody kind of is sick and tired to hear about COVID at this time, but it's still around us. It still can make us sick.
And Dr. Popp says the BA5 variant is responsible for about 79% of the cases out there right now.